Congo native Abdou Sebushishe is a senior health advisor with the International Medical Corps. A few weeks ago, he admitted a father to the Ebola treatment center he runs in eastern Congo.
He was really sick, critically ill, so he was not able to move by himself.
2 days later, his 11-year-old daughter came to the center with a fever. Sebushishe went to see her, completely hidden behind his personal protective equipment.
I brought in some toys. I started asking, what did you eat? She told me, what do you want to eat next? She told me, then I asked her, do you have any specific demand? She told me, I need to see my dad.
Sebushishe spent 30 minutes trying to explain why she couldn't. She had only a suspected case of Ebola, while her father's case was confirmed. Sebushishe asked if she had a message for her father. She responded in Swahili,
I'm here and I'm feeling abandoned. The way she said it, it literally said I'm okay, but I miss him.
Sebushishe relayed the message.
He was bleeding in his mouth, but he struggled to remove whatever blood was there and asked me, I want my daughter. That's the only word he was able to say.
Sebushishe started working on the outbreak in mid-May. By that point, Bundibugyo had already been spreading for months because healthcare workers had been testing for a different strain. Sebushishe says it was important to gather local doctors and construction workers to build Ebola treatment centers, or ETCs.
They need to know who we are, why we are there.
Some communities are suspicious of the doctors coming in at all. With so many suffering from hunger and malaria, why is this different?
We explained to them that we understand the issue, but that is way beyond our level. But this specific disease, we are trying to stop it to become an issue on top of many other issues they have.
Locals have attacked ETCs across the country because they're worried that their relatives aren't being treated well. He says that's common during Ebola outbreaks because doctors have to isolate patients. And if a patient dies, a trained team has to bury them.
Malicious people use that to spread rumors that, the doctors in those isolation units, they do remove kidneys and certain organs of patients.
To combat this, facilities have visitor centers with windows so families can see what doctors are doing. Ebola starts with a fever, just like malaria and typhoid fever. So people often wait to go to the hospital, if they go at all. Some people think that because there's no targeted treatment, the hospital can't help.
But doctors have ways to provide supportive treatment, so people come early to get treatment. It helps.
Things like fluid, electrolytes, and controlling a fever. In the beginning, they received mostly critical patients. One day in June, Sebushishe was already dressed in protective gear, waiting for 2 patients to arrive. They both died en route.
Some of those days, you wonder really, will I still keep seeing people dying around me? When you see also the distress of their families around.
On those days, he tries to focus on the people he's helped. A few hours after the 11-year-old girl came to his center, she tested negative for Ebola, but positive for malaria. They took her to the visitor center so she could see her father.
They could just put both their hand through the window. They cannot touch physically, but at least through the glasses.
She told her father that she loved him. Her father cried. Then they moved her to a different facility. Within a week, both father and daughter recovered, and the father was able to take what they call the happy shower, the final shower to disinfect a patient before they can hug their loved ones.
You can see the joy of everyone when we are discharging a patient. Everyone. The family is happy to reunite with their relative, but we are more happy because we are seeing at least someone that, we can discharge happily, reunite, give hope again to live one more day.
The Congo outbreak is showing no signs of slowing down. But every time someone walks out of his clinic, Sebushishe says it's one more person who can tell people that care is available. Reporting for World, I'm Mary Muncy.